Well, COPD and COVID may equal COVID lung. Well, that might be a term that you haven't heard yet, but you may be hearing more about it. Now, COPD affects about 22 million Americans right here in the US, and our next guest says that COVID may be a contributing factor to COVID lung for those with COPD. She's joining us this morning, Shems Tate. She's a clinical director with Health PHX. First of all, you have a way that you're helping people treat this condition. Shems, we haven't heard about it too much. So obviously you are finding a lot of patients who are in need. Is that right?
Yes. Thank you, Terry, for bringing me on. So like you mentioned, there is millions and millions of people who suffer with COPD. And now after they might have had COVID, been exposed to it, now their lung problem is even worse and they're dealing with lots of residual of this condition. So that is what we're trying to have available to the public so they can actually get the help that they need.
Oh my gosh, absolutely. Because if you've ever had any type of issue with breathing, you know how scary that can be. On top of it, first of all, how does your therapy help improve someone's breathing, and how quickly can someone expect to see some results?
Yeah, so the therapy that we have found is that basically we all have these cells in our body that are able to heal. We call it innate intelligence. Anytime you have a cut, your body is able to heal. So what we're trying to do is take these cells and redirect them to the problem area, which in this case is the lungs, where we're able to give these abundant cells to the area so they can repair the damage and allow for the body to heal naturally.
Okay.
And we have seen remarkable results. Our patients start to see improvements within the first week of therapy. It is truly miraculous, where patients are able to come off oxygen. They're no longer having to rely on their inhaler. I mean, it is truly mind-blowing how incredible and successful this has been.
I was going to say, up until now, I mean, really, how would you treat something like that, or how is it currently being treated?
Yeah, so currently there really isn't that many options. Again, none of these therapies that patients have are allowing the body to heal and repair. So currently there is inhalers, there is steroids, and when those fails, again, patients are having to rely on oxygen. And when that doesn't work, well, the surgery is next, whether there is reconstructive surgery or any type of removal of that lung damage that has happened. But this therapy is allowing the body to repair and allowing it to heal naturally.
Okay. And how long does this treatment, or do you call it a treatment or a procedure? How long does it take?
It's actually a procedure. So it's an outpatient procedure. Patients come in and out the same day. They're able to drive home. It is a very, very simple procedure. And like I said, within the first week, we have seen incredible results.
Yeah. And, breathing is not overrated. Let me just tell you, we all need to do it. So thank you very much, Shems Tate. We appreciate the information. Of course, if you need help, you're suffering with COPD and have what now is being called COVID lung, the first 25 callers will get a free screening and a consultation to find out if you might be a good candidate for this treatment. They have 2 locations, one in Scottsdale and one in Chandler. The number to call is 480-588-0737 to make your appointment.